The ovaries are a big part of the equation, right? We want to know that there's plenty of eggs, that they're releasing on time, and that we know they're meeting up with sperm. So a lot of times we'll do blood work to help look at those hormones and how the brain and the ovary are talking to each other. And we'll also look at hormones that we know are important for pregnancy, like thyroid and prolactin, blood sugar, things that can cause issues with making it a more challenging pregnancy. We also do an ultrasound when we're looking at ovaries because we want to look at something called ovarian reserve. We're basically trying to figure out where we stand on the timeline, right? Sometimes people have a lot of eggs and we may have plenty of time to try to do lots of different things, but sometimes we find we have more diminished reserve. So sometimes the blood work will show us that the brain's working a little bit harder, the ovary's struggling a little bit. So when we do the ultrasound and the blood work, we can get a much better idea of how the communication is happening between those two organs to help figure out if we're getting eggs to release on time and that we've got a good opportunity for eggs to meet sperm. Another part of the female infertility evaluation is looking at the fallopian tubes, and that's the area where the ovary and the uterus are connected so that the eggs can be picked up by the fallopian tubes and allow the embryo to make it into the uterus. And many women, when we check their tubes, they're fine and we know that the path is clear and open and we know that egg and sperm are meeting. But sometimes we find out that there may be an issue with the fallopian tubes. Some people have had prior pelvic infections, ruptured appendix, chlamydia, other things that could have caused issues with the tubes to maybe have some scarring or fluid collection on the inside. So when we do fertility testing to look at the tubes, we're ordering a test called a hysterosalpingogram, which is called an HSG for short. It's an X-ray test that gets done after your period, so that way we can see and make sure that the tubes are clear and that we know we've got a good chance for eggs and sperm to meet. The third thing we want to look at in the female infertility evaluation is looking at the uterus to make sure it's providing a good environment for an ongoing pregnancy. So if you're having a period every month, we know you have a uterus, but we want to do an ultrasound and some additional testing to make sure that we don't see any big fibroids or polyps or anything that could be standing in the way of an embryo being able to implant. As long as your uterus sees the right hormones, almost always it can carry a pregnancy successfully, but sometimes it can be a challenge for some uteruses that have had prior surgeries, or you may have had pelvic radiation or other things that could cause the uterus not to function as well. Even for people that know that they don't have a uterus, they might find success using a gestational carrier or surrogate to be able to carry their pregnancy if they're not able to do so themselves. So when we think about fertility, we think about, for the female evaluation, we make sure the ovaries look good, the tubes look good, and the uterus looks good. And it's a really easy thing to check, so I certainly encourage all my patients to get that done early on in the fertility treatment process, because the sooner we find out that there's something that we can help fix and identify how to get to that next point, the sooner we're going to be on our family building goals.